Definition and etiology of tuberculosis. So we define it as a bacterial infection and it acts on many systems of the body. The cause of tuberculosis is an infection with the bacteria Mycobacterium tuberculosis. It occurs only in humans, either in a latent or an active phase, and tuberculosis traditionally affects the lungs. However, it can also infect the meninges, the skeletal system, the GI system, and the urinary and reproductive systems. Of tuberculosis. So it's in the top 10 causes of death worldwide. In 2017, 10 million people fell ill and 1.6 million people died. Tuberculosis incident rate, it's falling at about 2%, and that's globally. In Australia, the rate of tuberculosis is 5.7 per 100,000 people. In the Indigenous population, it's approximately 6 times higher. Tuberculosis is most commonly contracted by droplet transmission. When a droplet containing Mycobacterium tuberculosis is inhaled, droplets settle on mucosa in the airways. The bacteria travel into the alveoli of the lungs, where they evoke immune response. The droplets are attacked and engulfed by macrophages. Although in a phagocytic environment, the bacteria continues to replicate. After 2 to 12 weeks, or once the bacteria has sufficient numbers, a cell-mediated immune response is induced. This response leads to the formation of a granuloma, which is a nodular lesion lined with T lymphocytes to reduce replication. Necrosis of tissue occurs at the center of the granuloma, which can rapidly reduce bacterial numbers. However, some of the Mycobacterium tuberculosis adapt to the low O2, acidic, and nutrient-deprived state that is necrosis. This is the stage that starts either the latent phase or initiates the progressive phase. In a healthy person, a calcified seal will be placed around the lesions containing the bacteria to prevent movement and ensure dormancy. This state will show no symptoms. The person will be perfectly healthy in regards to tuberculosis and also be unable to spread the bacteria to other people. However, in an immunocompromised person, an ineffective seal is used, which allows the progression of tuberculosis to its primary progressive stage. The necrotic tissue at the center of the lesion undergoes liquefaction, then can drain due to not being contained properly into the nearest vessel or bronchus to be spread around the body or to be coughed up. When spread around the body, is defined as an extrapulmonary tuberculosis because the bacterial infection is no longer contained in the pulmonary system. The signs and symptoms of tuberculosis are heavily linked with its pathophysiology. The common symptoms include cough, weight loss, fever, night sweats, hemoptysis, chest pain, and fatigue. The cough occurs due to the body attempting to eliminate the mucosa containing bacteria out of the bronchioles. Weight loss occurs for multiple reasons, the main being a loss of appetite and nausea that occurs during the innate immune response. Fever occurs also due to this body's reaction to an infection, attempting to kill the bacteria, and this is also closely linked to the reason why we can occur night sweats. Hemoptysis occurs due to the liquefaction of alveolar, capillary, and any other necrotic tissue from the infected lungs that drain into the bronchi. Chest pain is felt due to the inflammation of the lungs and tissue surrounding them, but it can also occur due to excessive coughing. Fatigue is a symptom felt mostly due to the weight loss/reduced food intake conundrum. The signs and symptoms of extrapulmonary tuberculosis are very variant due to the different types of tissue that it can infect. Some common examples are the meninges, which give symptoms like confusion, neurological deficit, and possible coma. Lymphoid tuberculosis will mostly show lymphadenopathy, and cutaneous tuberculosis will show skin lesions. Once again, however, the type of tissue dictates the signs and symptoms of that type of tuberculosis.